Sharing live stream. The content of this meeting is being sent to one or more apps. Press CMD and to reach the pop-up. The host has started broadcasting the meeting on YouTube.
Good afternoon to everyone present here with us today. This is Shreyan from IGCP, today's moderator. I would like to welcome all the viewers who have joined our platform for better exchange of knowledge that is going to be shared by our keynote speaker, Doctor, for today's session. With much pleasure and honor, let me welcome a very renowned professor, Dr. Mohsin Wali. Sir is MBBS, MD, FSCC, FRCP, FICP, MRCP, FIMSA, FGSI, FIAMS, FIACM, and Senior Consultant General Medicine at Sri Gangaram Hospital at New Delhi. Now, with the help of Sir and his wonderful insight, we will be taking a close look on today's topic, which is sudden collapse in young adult. Was it really a syncope? Now, without any further delay, I would like to welcome again Sir at our forum and would like to hand over the session to him. Over to you, Sir.
Thank you very much, Rion. And after a long time, we are meeting. And thank you, audience, for joining, which I can not see all. And thank you. And we dedicate our session to the memory of Dr. K.K. Agarwal, who was our mentor, our guide, and a dedicated, renowned cardiologist, a human being par excellence, and a teacher, and having much qualities of a thorough gentleman. So our salutations to him. And this is what is happening. This was a news 3 days back. This young girl, 26 years old, Tanya, collapsed in Edmonton. And she died, she fainted rather, and she died cardiovascular disease, cardiac arrest. And if you see this video, and realize what's happening. This is a Lebanese singer, and she's singing, holding the mic, and going to faint. And some people in the audience notice that she's fainting, and people are holding her, and she ultimately fell down. And this is what is happening day-to-day basis at many places. And here is a gym scenario. This is a camera movie. If you see this man who is doing gym, next to him is sitting a man. Concentrate here on this man. And this man is collapsing. And he is a fall down. He fell down. And now whole people are attending on him. So this is also at first go called fainting. See this haldi function in a wedding. And haldi function, his brother is coming. And he just had lunch. And he's trying to put haldi on his feet as per ritual. And see this red shirt, brown shirt man, as soon as he's trying to put haldi on his feet, what happens to him? Gone. He has gone. So the sudden cardiac arrest and syncope is confused. And in the meantime, I am telling the description notice in this video once again. So syncope is sudden loss of unconsciousness when a person is sitting like this and doing his chores, and then he faints. So how to differentiate between sudden collapse, that is syncope, or sudden cardiac arrest? Very simple way. If the pulse is palpable in this man, he will have syncope. If the pulse is not palpable in this man, he has a cardiac arrest or ventricular tachycardia or ventricular fibrillation, and therefore pulse will not be possible to feel. The problem is after COVID, these cases are increasing and we are not serious about them to identify the cause and to study them more. Where are they happening? In fact, they are happening all over the world. So what is sudden cardiac death or sudden death? It's an unexpected death due to cardiac causes that occurs in a short time period, generally within 1 hour of the symptom onset in a person with either known or unknown cardiac disease. And these patients may have prodrome, sometimes in the form of fatigue, chest pain, palpitations, and other non-specific complaints like numbness of the fingers or giddiness, vertigo, exhaustion, and feeling of thump in the chest, pain coming to the jaw, like these are the symptoms. So let us first know what is a heart attack and what is sudden cardiac death. These are again, first we differentiated between syncope, which is a fainting due to an unidentified cause in which the person will faint and still will have pulse. But this video will clarify how this happens. Sudden cardiac death means the heart continues to beat for some time and then this beating becomes erratic. And therefore it becomes so shallow and so fast that the pulse is not felt. This has started becoming faster and irregular. You see, the upper portion is not contracting, the lower ventricle is contracting at a very fast rate. It's like a vibration. The ventricle, that is the lower part of the heart, is vibrating. And in this is regular. Now, heart attack. Heart attack, when this heart is beating, you see the red spot. There is a narrowing of the coronary artery, and then blood does not flow through this plaque. And part of the heart muscle, which is supplied by this artery, is now looking brownish, darkish, and getting death in this part of the muscle. So this is myocardial infarction. So this occurs without warning, and therefore patient may not feel any signs. So what are the risk factors? Maybe there are genetic factors, then CHD risk factors, that is arrhythmias. CHD means congenital heart disease. Arrhythmias means irregular heartbeat due to other causes, nutritional, psychological, and there are some biomarkers we have identified, including genetics we have identified. I'll discuss in the next few slides. So these are all causes of sudden cardiac death. Now the genetic contributors to this kind of sudden deaths. You see, this topic has become, every day it is becoming very important. Every day, every place, some one or two people like this are dying. So either they have congenital long QT interval syndrome, short QT interval syndrome. One is known as Barguada's syndrome, in which genetic factor has been identified, SCN5A. Then there is a high release of adrenaline, noradrenaline, and where we don't know the cause, and it could lead to irregular heartbeat like ventricular fibrillation, ventricular tachycardia. Then there are inherited structural disorders with arrhythmic sudden cardiac death risk. That is hypertrophic cardiomyopathy, right ventricular dysplasia, oblique cardiomyopathy, which is rarer. Then there is a long QTS, drug-induced, long QT syndrome, drug-induced. Then there are metabolic abnormalities. So this sudden cardiac death is the one in which between the prodrome and the cardiac arrest, it happens within 1 hour. And that is how we have to provide the treatment as early as possible. And then there is a permanent damage to the brain if we don't do cardiac massage in such patients. So this is the difference point, that it happens up to 1 hour, and this does not give us time. There are various epidemiological studies in a smaller number, and what we have not found any solid cause for this, except for underlying some abnormalities. In the heart attack, the most rapid rate of attrition occurs during first 6 to 18 months after the index event. This is a known fact, which we do save patients by CAT, by angiography, by stenting, by bypass surgery. And sometimes later, these patients have low ejection fractions, which is not the topic of today. If you see the ratio between men and women, mostly men do have sudden cardiac deaths more as compared to the women because of certain hormonal changes, weight changes, body profile, and there are more congenital abnormalities in the females we see day to day. We have lost many important people, and in sudden cardiac deaths, like we lost Siddhant Suryavanshi, we lost Siddharth Shukla, we lost Rohit Sardana, who was a gym goer, a very healthy person. And this was a couple in Beraich who were found dead on the next day of morning of their wedding, next morning, and they were found dead. And they had no city urban issues, and they were simple people, non-alcoholic, non-smoker, young. Still they were found dead due to heart attack. Then this classic case of Gaurav Gandhi, who was a practicing surgeon, cardiac surgeon, Jamnagar. We lost him at a very early stage. You see, he is simple, slim man and not obese. His neck is thinner than the collar size. And still he had sudden cardiac death at the age of 41. This should have been an eye-opener for the whole community. We haven't done anything in this direction so far. We lost very early when I was with President. We held the news one time morning, General Joshi collapsed in golf course. We also lost President Kalam. Same way, he was busy in a speech and we lost him. Then we lost our voice of ISRO. And this lady collapsed while giving command to Chandrayaan. I'll play this video again. 3, 2, 1, 0. And her countdown after this. So these are the various causes which can contribute, like coronary abnormalities, left ventricular hypertrophy, diseases of myocardium, inflammatory, neoplastic, degenerative diseases, disease of cardiac valve, congenital heart disease, ECG abnormalities, electrical instability related to neurohormonal and CNS influences, sudden infant death syndrome, which is responsible for sudden cardiac death in children, and there are other causes. Like we lost Damar Hamlin. This is another cause which is not listed so far. Sometimes we find it mentioned. Damar Hamlin collapsed in the field, and this was very serious accident. He was revived, of course, but we could not save him finally. So this is sudden injury on the chest. Sudden injury on the chest causing a thump-like effect while the heart is in relaxing position, which is called commotio cordis. Same way, if you see this video, they are playing karate, and this man got hurt and then collapsed. So this is not syncope. This is sudden cardiac death. And this is happening every day, everywhere. And prevention of sudden cardiac death requires a global approach. This is very important. And it kills 800,000 people every year, maybe more now, which are not being documented. Smoking, to some extent, we have identified as a cause. And this smoking is a very important preventable cause. And therefore, how smoking kills us? Smoking increases the risk of coronary heart disease, especially coronary spasm, sudden death, heart failure, stroke, peripheral arterial disease, in which we have problems in the legs more than problems in the heart. That's why we call it peripheral. Cardiovascular mortality is affected by smoking in type 2 diabetes. In general population, second-hand smoke also increases the risk of cardiovascular death and all-cause mortality. Smoking is associated with worse dyslipidemia, difficult to treat dyslipidemia, and it increases pro-inflammatory markers. These markers we test nowadays, and I will talk about a new marker which we have recently identified. So smoking kills through various processes and also is a cause of lung cancer for sure. Then arterial hypertension, which we commonly call blood pressure, and we are not mindful about our blood pressure. While you are reading, I will tell my take on this. You see, young children these days, if you go to a school in a class of 50, you will find 2 to 3 students having high blood pressure. This is very, very important to detect at the young age if the people, our children, are having high blood pressure, because there is a rule of 50% with this deadly disease. Half of the people who are walking on the road do not know they are having high blood pressure. And out of them, only half go to the doctor. This is again a tragic statement I'm making, and this is a fact in even developing countries. And later stories same that half of them who are treated, they get normal blood pressure, and half of them do not get normal blood pressure. Very, very painful story. And something disturbing is coming on the screen. I've removed that. Now, then if you treat successfully, there are some studies here I have talked. Our aim is to keep the blood pressure as low as possible. Don't go by numbers. The lowest is the best. As low as you can tolerate. Some people, I have my average blood pressure on a given day like 112/70, 110/70. Some girls come to me, they have 90/50. So don't get alarmed and panic. Oh, my blood pressure is very low. Lowest is the best. Hypertension, anything above 140/90 has to be treated. Please be sure you know your numbers. And that is the message we give always on the World Hypertension Day. Know your numbers. You have to know your numbers. Your blood pressure. Like when you go to college, you should know what is your blood pressure. Very important. Then this is another disaster that we have stopped doing physical activity. It is very important cause of cardiovascular mortality. We require at young age vigorous activity more than 75 minutes. This is the shortest. More than 75 minutes means anything above that. Ideally, when somebody asks us how much exercise we should do, we tell him half an hour minimum, 5 days a week, out of which 50% should be vigorous exercise, weight training or running. 50% should be moderate exercise. I will not name any exercise. It could be running it on the treadmill, it could be weights, it could be Pilates, it could be yoga. Anything which makes you exhausted and it makes your pulse go up by at least 20% of your basal heart rate. And this is very important. And I am saying 20% because gym people will recommend you higher pulse. I would not endorse that. Suppose your basic pulse is 100. During peak running, it should go up to 120. Usually we have 80 to 84 pulse rates. So calculate 20% of that. 80 means 96. And beyond that, you have to be very supervised for any vigorous activity, because our health minister also warned when so many children collapsed due to sudden cardiac death in Dandia. He came up, Mr. Mansukh Mandavia came up and said, don't do vigorous physical exercise. So I'm not promoting vigorous physical exercise. I am promoting exercise, which we always say we will start from tomorrow. So increased physical exercise activity have shown to improve glycemic control, blood pressure. It improves biomarkers in type 2 diabetes. It controls lipid profile. It has been associated with lower risk of cardiovascular disease and mortality in type 2 diabetes. And it should be structured exercise, training recommendation based on recommendations by healthcare workers consisting of aerobic exercise, resistance training, or both. Both are effective than doing no physical activity. Then these things, people come for a magic pill, reduce weight. Today morning, I got a call from a very important officer in the government of India. His daughter went for gym. She came home totally exhausted. And because these girls are wearing watches, and watch gave her pulse 152. And father called immediately, what can we do? I told them what is to be done, like carotid massage I offered, and the pulse came down to 100 and gave a beta blocker. But what the lesson I learned this morning was unwanted exercise. This was her fifth day to the gym. She did Pilates. I spoke to her also on video call. She did Pilates for 55 minutes. Yesterday, my daughter was telling she did it for 10 minutes and it was too much for her. So you have to know your range of exercise and it should be well supervised. You see, there is no pill to lose weight. There is no magic pill so far, nor it will come in future to reduce the weight. Weight is reduced as you have attained. You have attained weight by inactivity and overeating. So same day, reverse of that you have to do activity and reduce eating. This is what is my message for today. And these all wonderful names which are circulating between youngsters and even ladies and other people also, diabetics, obese people, all these magnificent and recent additions to our armamentarium of weight loss devices is semaglutide. They may have side effects 10 years later. Then in the past, so many people have gone for bariatric surgery. These are the things which people are taking for prevention of cardiac disease, but this is not prevention of cardiac disease. This is after the obesity has come up and it bypassed every norm, and you have karate, snoring, obstructive sleep apnea, you are at the verge of developing diabetes, you are at the verge of getting degenerative changes in your knee joints, you are at the verge of getting faster aging. These are the shortcuts, which also don't work. Bariatric surgery I am naming here. It sometimes they claim it reverses diabetes, it causes too much loss of weight, but that too much loss of weight is sometimes catastrophic. Now, this is what you can avoid. Abstinence from alcohol is recommended, and we have people who are very brave who consume large amounts of alcohol now, and even girls have started taking in metropolis and otherwise. So, alcohol consumption, we as doctors for heart and liver do not recommend these days because there is no limit when we can increase, there is no limit when we have to stop. So alcohol takes away from us the ability to judge when to stop. So no amount of alcohol is recommended. Some people plead for 2 glasses of red wine. Maybe you try and then you see a liver doctor after a few years and then he will tell you to stop. Anyway, both ways. And here I also joke with people who are not convinced. I tell them that alcohol is one of the products of the carbohydrate digestion. And people make alcohol in their stomachs, and therefore we don't need to take alcohol from outside. Some of you can check products of carbohydrate digestion. One of them is water, and other is alcohol. This is taught to us right in the class 12. Then nutrition, we have gone awful on our nutrition, especially young generation. You see, we know this is an area where everybody knows eating momos, eating double burger, eating pizza rich in cheese, is not good for health. Eating junk food, I would say, is not good for health. But we do not implement on ourselves. There is a new thing has appeared which is called cloud kitchen. This cloud kitchen is located where nobody knows. So our children are eating junk food, which is very high in calories but very low in nutrition. And therefore, we should put a stress on nutrition. And our grandparents, when we used to live in joint families, would guide us. In nuclear families, there is nobody to guide. The children are eating what they like, and their mothers don't take pains to prepare those things at home which they like. I was talking to a young boy yesterday who works in one of the leading junk food companies, and their tikkis come from Hyderabad. They are distributed in the various cities, metros. And how old is their tikki, their bun, which is traveling from Hyderabad to Mumbai to Delhi? We don't know. And what have they kept in that? We don't know. So this is what is the condition of the leading brand, which starts from M. You must understand what brand I'm mentioning. So the solution is this plate. It shows sugar control, it shows waist control, it shows blood pressure control, it shows message for exercise, control your BMI, and control cardiovascular disease. So what to eat? What to eat means what to eat, what to bring from market, what to think, and what prevents you going to doctor. If you follow exercise, which is a red dumbbell shown here, if you keep control of your blood pressure, if you eat to maintain your waist size, if you take your blood pressure regularly, keep it under control, you take green vegetables. So all this is message in this. And my dear friend, one dear friend has written a book on diabetic control, and he has taken this image from me to put as a cover page of his book. And this book is out in Kanpur Medical College. And this whole, what I'm talking, is lifestyle behavior. And there is important relationship between glycemic control and concomitant depression also, stress also, anxiety also. And all of us go through that. I have a test which measures stress, and I have measured my stress 3 weeks back when I had more, and yesterday it was less. So we have now measurements to stress also by artificial intelligence. So our doctors should have time to talk, to care for the patients, and we should not just tell the patient in a form of diet chart, which I discourage, but the patient should know when to stop. Everyone should know when to stop. Even a healthy person should know when to stop. So the best combination which is harming is obesity and not doing exercise. So this is the harm for everyone. And as per definition, most of us cross our BMI to the extent that very recently Lancet has disqualified 70% Indians that they do not conform to the WHO healthy norms. So recently, this I made some days back cutting from newspaper. This was 28th February 2024. There was a news in the Hindustan Times. Processed food intake, high processed food intake linked to high risk of 32 illnesses, in which cardiac disease, on which we are talking is also included. Cancers, heart and lung conditions, mental disorders. This is a BMJ article. And this is what our even people who are supposed to walk, lack of exercise make them so plump in a department which is abdominable. So lifestyle management is very important for preventing heart disease, CVD, and much emphasis is to be made by parents, by school teachers, by our guardians, by doctors, Even Prime Minister has now started saying that we should prevent obesity. Recently, he demonstrated yoga. All of us did yoga that day, but yoga is for every day, for everyone. This is what is the message by this talk is what we are, what we eat. So keep eating healthy, vegetarian diet, and stop all these burgers which come from, I don't know where they come from. Some of them come from cloud kitchen. And this is our younger generation today, which are very fond of showing this sofasan. This is the asan which I have named. Means you are inactive, you are eating at where you are lying, you are eating what you call popcorn, pizza, watching TV. And this slide shows many things. An obese person lying, not active, he may have all pre-diabetes like condition, hypertension, and he's eating wrong kind of food. And perhaps a bottle of beer is also kept on the table. So all this is a very, very common practice at our youngsters' home, which parents probably are not aware. So parents, do take care of your children at young age. Otherwise, they will become sick. They will have CAD, premature death, hypertension. So this is what I was talking. The substitute to these diets, which are called unbalanced or which are called very unhealthy diets, junk food, is millets. And our Prime Minister has taken lead in this also. And he has named this as Shriyan. Now, yoga, I was talking, here is an example. And to make yoga interesting, this is one of the aspects you should practice at home. Both husband and wife, same time, can practice yoga. I call it couple yoga. It's very interesting and very exciting also. And it generates interest in health. Then, now this is another problem, lipid abnormalities. We all know that cholesterol deposits in our arteries, and there is no way we can stop depositing it except eating it less. Burn it with exercise. Drugs should come in the last, and we should be mindful of our intake of fat, cheese, and very high carbohydrates, which also increases triglycerides. Then this is the, you can say, help we take with the blood thinners when we have stents or all this. Antithrombotic therapy cannot be given in routine. It's only given when it is required. But lipid reduction therapy, we have named it, one of my friend has named it as a lipid passport. Same way I was telling blood pressure, you should also get your lipid profile checked when you enter in the college. 22 people or more must have died when we are doing this talk. And one of the things which Dr. K.K. Agarwal was very fond of was everybody should learn what you call as CPR,
accomplishes two critical things.
cardiopulmonary
One,
resuscitation.
Compressions move oxygenated blood to the brain.
So this video shows how we should learn CPR. So CPR is very simple. Everyone can learn CPR. How to place hand on this chest bone, which is called sternum. How much to press is to be learned. How many times is to be pressed is to be learned. Previously, we were giving mouth-to-mouth respiration. Now it is only chest compressions, and it improves the blood circulation in the brain in continuity so that brain doesn't die. And it should be deep pressure. You see in the drawing that the blood going up to the brain, the compression has to be so deep that it is going to the periphery and also to the brain. So the aim of doing CPR is to prevent the brain death mainly. Our other organs can survive lack of blood, but the brain beyond, this is what I was telling, how much should be compressed, minimum 2 inches. And it should be continuous, 100 to 120 compressions per minute, regularly without stopping. And then someone asks how much time we should continue CPR in a patient like this. When you are transporting patient, when the patient in the ambulance, keep doing CPR till you reach to the secondary or tertiary care center. Then we reach to the tertiary and secondary care centers. In tertiary care centers, we subject our patients to coronary angiography, which is very readily available procedure in the big hospitals, big cities. And then we can do pacemakers. This cartoon is a video which shows how a pacemaker is required, how the pacemaker is placed in an erratic heart, not the beating of the heart, upper and lower portion, they are separately beating. There is no coordination between lower part of the heart, that is ventricle and atrium. So this is a condition. This is ventricular flutter, ventricular fibrillation. So pacemaker saves from this condition. And drones are now being used to transport the life-saving device, which is called life pack or cardiac resuscitator or ventricular defibrillator. Now these are portable devices, and this can be delivered by drone in a person who has got a sudden cardiac attack from a central command station, and then the instructions can be given through the central command, and this drone is reaching within 2 to 3 minutes and bringing the life pack, giving command on phone, and this remotely controlled life pack or defibrillator is remotely controlled, so you don't have to know how to operate defibrillator, but you just have to know how to keep the pads, which are also directed on phone, which is simple, just keep 2 pads, rest is done by the remote control station. And I'm very fond of showing this dance for some reasons. And this is 210, Charlie White and Merrill Davis. And the message through this is keep active, keep happy, follow Indian traditions. They are doing ice skating, wearing Indian dress, and they won the prize, and they are singing Indian song. So this I have shown in the last, so that we promote the exercise through these games. It's not that ice skating is done for fun. It's a worldwide message through all the sports, all the sports, all types of the sports, be it Olympic, be it a district school sport. The message nobody talks about their messages of exercise. So think positive, avoid anger, stop negativity, do meditation, sound and quality sleep. I have not talked about sleep yet, so here is a message for sleep. Leave hatred, jealousy, and all negative feelings, ill wills. Help people and live long to keep your heart healthy. These are the 5 things, 6 things. Follow them. Avoid anger, think positive, stop negativity, and do some meditation. Yoga is also meditation. Have a quality sleep, leave hatred, and help everyone. So keep your heart on the track. This is the message for all of us, for today, for tomorrow, forever. Thank you very much.
Thank you so much, sir, for this wonderful presentation. We do have some question if you like to take that up. So am I audible?
Yes.
Yes. So, sir, I was asking you few questions. So, sir, the first question is, what are the key red flag signs that differentiate begin Syncope from the life-threatening cause of sudden collapse in young adult?
Well, Red flag signs is if you are fainting again and again, you have some disorder which is triggering fainting. It could be some convulsive disorder, or it could be some aortic insufficiency, valvular heart disease, subclavian steal syndrome, or anything. But if the telltale difference is your pulse should be felt. But if you have sudden cardiac death, I have talked everything about that. So my aim is, if your pulse is there, you're not that serious. If your pulse disappears, you're in a very serious situation. So these are the red flag signs in sudden cardiac death: are feeling of tightness in the jaw, around the neck, having chest tightness, chest pain, having palpitations, having high blood pressure readings, having ECG abnormalities, having one or two occasions of collapse also, syncope also. So you should know your body before all this happens. Why I have shown all this is we should know our numbers. That means we should know our blood pressure. If you go to a school, go to 10th class, ask a boy or girl, what is your blood pressure? They will not know. Nobody is talking about blood pressure. Huh? They are talking 200 years back what was happening in the history. What is happening today to our children, they are not talking. In advanced countries, they don't teach irrelevant things in the class. We have been studying a syllabus which was made 200 years back. This is the tragedy. So know your numbers means know your sugar, know your blood pressure, know your heartbeat, and mind about your food. Numbers means calories also. How much calories we are eating. So this is the red flag. Pani did right.
So next up we have, should all young adults with external syncope undergo echocardiology and Holter monitoring?
It helps, but let the doctor decide it. First of all, ECG will tell. And then, yes, Holter is a very important monitoring device. This is always decided by doctors.
So we have one last question. How important is family history in identifying cardiomyopathies or sudden cardiac death syndromes?
Very important, very important. I had shown a slide in which I have shown genetic influences, and we should take history. Like in this slide, I have shown, if my screen is visible, these are the conditions which are genetically identified: long QT syndrome, SCN gene, and history of sudden cardiac deaths is very important. We should always ask about history of the sudden cardiac death, and history of hypertension, any history of cardiac surgeries, valve replacements. So this is very important. See, part of our talk, which was syncope, has so many systems to be involved, like central nervous system, cardiovascular system, and it could just happen after any cardiac shock or any general shock also. It could be just functional. One can faint. So fainting is not important. Syncope is not important. Cause of syncope is important. Like if a person at 2 o'clock in the night passes urine standing position, that we call is micturition syncope. So syncope can always not be due to cardiac cause. So we should know the cause of syncope. Since you have involved this word in your program today, I would emphasize that syncope is a general term, बेहोश हो जाना, गिर जाना, कॉन्शियस हो जाना, बट जिस अनकॉन्शियस में आप मरीज की पल्स नहीं फील कर सके, वो सिनकपी बहुत खतरनाक होती है. उसको हमें सीरियसली नहीं ले सकते उस वक्त जब वो हो चुकी, पल्स चली गई, प्राण पखेरु हो गए. तो ये सारी बातें जो हमने की हैं, खाने के बारे में, स्मोकिंग के बारे में, वेट के बारे में, कोलेस्ट्रॉल के बारे में, ब्लड प्रेशर के बारे में, गुड लिविंग के बारे में, गुड स्लीपिंग के बारे में, ये इंपॉर्टेंट होती हैं. इस सिनकपी जो कार्डियक सिनकपी है वो ना हो, इसके लिए होने के बाद कुछ नहीं हो सकता. बहुत कम चांसेस होते हैं जो बच जाते हैं लोग. जैसे वो आपने प्लेयर को देखा, एम्बुलेंस भी आ गई, रिवाइव भी हो गया, अस्पताल भी चला गया, उसके बाद बच नहीं पाए। तो सब चीज अवेलेबल होने के बाद भी नहीं बच पाएंगे। उससे पहले उसके लिए अब मैं एक दोहा सुना के प्रोग्राम खत्म करूंगा। कबीरा कभी तभई न चेतिया, कबीरा कब तभई न चेतिया, जब डिग लागी बेर। अब के चेते क्या भया, जब कांटों ने लीना घेर। जब नीम के पेड़ के पास बेरी का पेड़ लगा तो उस समय होश नहीं आया। अब जब कांटों से नीम का पेड़ गिर गया तो अब हवा चली और वो कांटे उसके पत्तों को तार तार करके खत्म कर रहे हैं। तो ये जो बीमारी पैदा होती है, ये बचपन में पैदा होती है। कोलेस्ट्रॉल बचपन से बढ़ना शुरू होता है, प्लेग बचपन से बिल्टअप करना शुरू होता है। यही हम आजकल हार्ट अटैक के पेशेंट्स को भी समझा रहे हैं कि 24 घंटे में प्लेग मत रिमूव करवाओ, वेट करो जान बचाने के लिए। इससे पहले कोशिश करो कि ये हो ही ना, और उसको डाइट के थ्रू होगा, वो एक्सरसाइज के थ्रू होगा, प्रॉपर स्लीप के थ्रू होगा, पॉजिटिविटी के थ्रू होगा, और स्मोकिंग नहीं करने से होगा, अल्कोहल नहीं करने से होगा। अभी हम करा रहे हैं लोगों का लिवर का टेस्ट, ये आ रही रिपोर्ट, खूब सारा अल्कोहल पीते हैं, इनकी रिपोर्ट खराब हो गई, फाइब्रो स्कैन बहुत खराब है। तो ये अभी पकड़ेंगे इनको तो ये फिर लिवर ट्रांसप्लांट से बच जाएंगे। तो ये डे टू डे जो हमें करना है वो मैसेज जाना चाहिए। किताबों में सब लिखा है, हम जानते सब है, मानता कोई नहीं है। थैंक यू।
Thank you so much, sir, for answering all our questions. That's all from our audience, sir. Before concluding, any take-home message?
I have given all the take-home messages in the last.
That's true, sir. It was a wonderful session, sir, with you. It's a pleasure that we have you here with us today, sir. Thank you so much, sir, for this session with us.